Hello everybody, I'm Dr. Sahitya Bommidi and I would like to discuss about the vaginal discharge today. Vaginal discharge is nothing but the fluid or mucus that comes from the vagina. Usually the vagina has some kind of glands in it, and these glands produces some kind of secretions, and that's the reason why some amount of fluid that comes from the vagina is considered completely as normal. This vaginal discharge can be a normal vaginal discharge or a physiological vaginal discharge, or it can be abnormal also. This normal or physiological vaginal discharge can be there just prior to the onset of menstruation, after the menstruation, and in between the menstruation when the egg is getting released. Usually, normal vaginal discharge or physiological vaginal discharge is white in color and it is sticky in consistency and mucoid in nature and odorless. But if this vaginal discharge is associated with some kind of itching, burning sensation or soreness of vagina, or if it is associated with some kind of pain in the lower abdomen, or if there is some kind of change in the color into grayish, yellowish or greenish in color, immediately you have to seek the gynecologist advice. Whereas the gynecologist, as soon as you go to the gynecologist or you meet the gynecologist will ask you few kind of questions related to the vaginal discharge, and after that they'll do the examination. Until we do the examination, we cannot treat it, because there are different causes for the vaginal discharge. It can be a bacterial infection, it can be a protozoan infection, it can be a fungal infection also. So until we see it, we cannot treat it. So if you have any kind of abnormal symptoms, as I mentioned it before, immediately you have to consult your gynecologist, and the gynecologist will do necessary investigations or examination part and then give you the treatment accordingly. Thank you.